It was never the intention that this model was going to be cut in stone. It was part of coming out with a proposed concept for all the reasons that we explained during our community chats.
A bit of a shift in perceived tone from Harrison, where many thought this model being proposed was the one MAHC was definitively moving forward with. Harrison now saying that's not the case, and that they're committed to continue hearing from the public on what these two new sites should look like.
We are continuing on with the listening and the consultation with stakeholders. There is a board meeting in March, our regular board meeting, but no decision is even coming forward at that point. That was a date that we were kind of leaning towards if we were able to move things along. But we've heard our community and others, and they really want us to take the time, and that's absolutely going to be our promise to do that and take the time needed to meet with everybody and listen for feedback and make adjustments.
And speaking of public consultations, Harrison says they've been in consultations since the town halls were held earlier this month, and there's plans to speak with more medical professionals that would be working at and using these sites.
We had a meeting this past week with our nursing staff, and it was, again, we asked for feedback on what they saw the strengths of the proposed model would be, what would they like to see made different, and we're going to continue with having those engagements with our nursing staff. We were also invited to attend a meeting with the physicians and midwives that was organized by their staff association. And again, we had a very facilitated conversation, heard great feedback on some of the strengths of the proposed model, as well as concerns and opportunities for improvement. And so we are going to continue with those discussions with the physicians, hoping to schedule something in the next couple of weeks. I think that folks know that there was, the physicians worked hard on a proposal called Care Close to Home. And we received that just after that session this week. And so we're going to look at that. We're going to bring that into the discussion as well with the physicians and midwives.
One thing that stood out in the proposal from the South Muskoka Medical Professionals Group was a lack of population accountability for the areas outside of Muskoka, including East Perry Sound and Almaguin, which the Huntsville site would be responsible for serving as well. Harrison says those numbers are important to include in their own planning.
We have to take those numbers in. When you're planning a hospital, they ask you to look at your catchment area. And often in rural communities like this, you do have quite a reach. So you've mentioned the Almaguin area, and then to the east, we use numbers around the number of visitors that come through in the summertime, especially through Algonquin Park. And so that's another area, actually quite most of the way through Algonquin Park. The Huntsville site would be the go-to hospital in most cases.
Now, one big concern was the idea that dragging the planning process for these two new sites could lead to a disconnect with the province, and even worse, losing priority for funding, which could set the entire project back years. Harrison says that's likely not the case.
We are in constant conversation with the ministry on this project, of course, because we are on the infrastructure schedule and we want to make sure we're keeping them abreast. They are very supportive and have been supportive to take the time we need to do the consultation. And, we can't take another 2 years by any means. And I don't know what that time is going to look like. I feel we're in a good place to start having, more wholesome conversations on the model. And, with any hope, we will, be ready to put a submission in, in the near future. But again, we want to make sure that we are making the changes that we need to make and having folks that are buying into, at least most people buying into the model going forward.
Finally, Harrison says there are plans to meet again with members of the general public, not just healthcare professionals, to make sure everyone has a voice in this proposal. But it may look a bit different than the town hall style MAHC has used these past 2 years.
I think we need to keep the momentum going. And as we get closer, rest assured, the consultation with our community is going to be important. And we are looking at some sort of structure so that very early on we can get the community engaged in some different consultation other than, the town hall was obviously a great venue for letting people know where the status of the project was and that there was a proposed model that we were looking at. What we want to do in the next type of venue is actually engage them so that they're participating a little bit more. So I just say to the listeners, stay tuned, watch for invites in the near future.